So this is a presentation put together by the Tillamook County Citizens Health and Safety Committee. You'll see the list of names as part of the presentation. As is typical of our community, we have some extraordinary people with extraordinary talent who are willing to spend their time trying to help the community. And this is a really good example of just a blue ribbon task force that I am very impressed, very pleased to be working with. OHA came out today with a report that said we have a 34% spike in COVID cases. We had 597 new confirmed cases. We had 2 new cases in Tillamook. The total deaths in Oregon are 705, and this last week we had 4 deaths. This is not going away. It's getting worse. It will continue to get worse as we move into the winter months. And being prepared for it, making sure you have your flu shots and making sure you are doing what you need to do is critical. And from the city of Manzanita's standpoint, thanks to the support of our staff, particularly Josh Ganby, we have updated the website in the COVID section, and you will see all of the updated information along with the presentation that Victoria will give tonight in the event that you would like to look at it again. What the city can do and how the city can respond, initiated by Thomas's question, to see how we can move forward in a way that's effective for us all. So with that, I'd like to turn it over to Victoria.
Thanks, Linda. So this is similar to a presentation that I gave last Friday to the City Council and other interested people. And I, again, want to emphasize that I'm representing this committee that is the North Tillamook Citizens Public Health and Safety Advisory Committee. We're a volunteer group of kind of a self-organized group. Some of us had been getting questions, requests for advice about COVID, specifically from people in the community. And we decided maybe it would be a great idea if we got together and shared our expertise with each other and then could make recommendations as a group. You can see the members here, and 2 of them are city council members, as you can see. And we now have a way to be contacted. citizenhealthandsafety@gmail.com is our brand new email account. So if you would like to get in touch with me or with anyone on the committee, just use that after this presentation. So thanks for inviting me to be here, and I'll get going if I can. Well, I showed this graph on Friday, and in the 5 days since I showed the graph, things have gotten substantially worse in this country. We're nearing 100,000 cases a day. I think we had 1,100 deaths today. So you can see we're having an exponential increase. There is no national plan. The White House has said they do not plan to try to control the virus, but would wait for vaccines and therapeutics, and vaccines will be conservatively 6 months from now. So take a look at that slope and realize that we're just about ready and already are headed into truly uncharted territory. So I'm quite alarmed. I guess if there's one thing I want to share with you is that I am an epidemiologist. I was an academic epidemiologist at University of Washington for 30 years. And I've never seen anything like this. Nobody has. So I'm quite alarmed at what this means, both for the country and the state and also our community. So here's what's happening in Oregon. And again, in the last 5 days, things have gotten worse in Oregon. We've had several over 500 case days in Oregon, but we see a similar pattern that we're starting from a higher plateau in the late summer. And now we are escalating, just the national data are. Well, the question is what's happening locally, what's happening in Tillamook County. It's a little harder to see because we have smaller numbers. So over the last 8 months, we've had 80 cases total in Tillamook County. This only shows July through the end of October. But you can see we have the same issues that are happening nationally and in the state. 14 cases in August, 14 in September, 27 in October. There have been 2 or 3 already in November, and we're at the 4th of November. So we've had a third of our cases have occurred in the last month. So although you can't see the pattern as easily because of our small numbers, I would say we have similar to the country and Oregon. In this county, we're having a dramatic increase in cases. Well, what else do we know about our area? We know that we do not have Manzanita specific case information. It's not available from the Oregon Health Authority or the County Department of Health. So Oregon Health Authority is now giving numbers, total numbers of cases by zip code, but they are not giving them for our zip code because we have fewer than 1,000 people. And similarly, the health department has said they will not be releasing numbers for Manzanita or Nehalem. So we won't know what's going on locally, and we really do need to just think about what's going on in the county and assume that what's going on locally is similar to what's going on in the county. Previously, in some of the meetings I've gone to, the Friday meetings with the city council, there's been a desire to know when there's a surge of cases. When will we know that we have to do something different? That's certainly, that's just a logical conclusion. Let's find out what's going on and then we'll do something differently. Well, as I said, we're not going to know when there's a surge because we really won't know the numbers. I would also say that we don't want to wait for a surge because we actually can't deal with a surge here. We don't have the hospital beds in this county to deal with a surge, and we don't have the personnel to deal with the kind of contact tracing that would need to be done if there were large numbers of cases. The other thing I want to point out, because one strategy for potentially dealing with the disease in our area is to test everybody. So surveillance testing, that's surveillance testing, not just testing people who've been in contact with a known case, but just testing everybody or a random sample of people. Well, testing with the rapid tests wouldn't be effective and it wouldn't be acceptable because given the level of virus, at least currently in our county, for every 16 tests that were positive, only one of them would be a true positive and the other 15 would be called positive, but they really weren't infected. So that's not going to work. I think that would be detrimental to trying to get citizens and residents on board with that amount of misclassification. So the bottom line is the best thing we can do in Manzanita and North Tillamook County is prevention. Prevention is the only strategy that will actually protect the people in this area. So we have, as a committee, come up with a few ideas for a COVID-19 prevention plan. We think about it in terms of 3 steps, and I presented step 1 at the meeting last Friday, and steps 2 and 3 are new information for those of you who were subjected to this presentation on Friday. Step 1 has to do with individual behavior changes that the city really can deal with right now, and we've already talked about one of those with the limiting social get-together size. Step 2 is what might the city do to prepare for a change in the phase of opening? So currently Tillamook County is in phase 2. That's the highest phase available, the most open. So what might you want to do to prepare for a change in phase? And then step 3 is thinking about targeted testing and case and contact follow-up. So let's talk about step 1 first, individual behavior change. As has already been mentioned tonight, there are state requirements for all counties at all phases, no matter whether you're at baseline, phase 1, or phase 2. And there are 3 or 4 things that are common requirements, but the 2 that are important in terms of behavior change in Manzanita are the ones listed here. First of all, masks for everyone age 5 or older are required for all indoor public spaces, all private and public workplaces, all indoor and outdoor markets, and all outdoor public spaces where a 6-foot distance is not possible between people. The second one has to do with social get-togethers. So statewide, indoor social get-togethers are capped at 10 people. And that means parties, dinner parties, birthday parties, graduation parties, celebrations of any kind like Thanksgiving, potlucks, book clubs, game nights, anything where people get together for a social purpose. That is limited by the state to 10 people maximum if the event is indoors. So what can Manzanita do to change people's behavior? So I will have to say that my husband and I have conducted a few informal surveys recently just to see what's going on Laneda Avenue. And we both found out in different forays out, that about 2/3 of people that we saw were not wearing masks on Laneda. So I know that the city either recommends or requires masks on Laneda, and I think that's an important distinction. And so I trust that Thomas will bring that back up. But my personal feeling is that it's not well known to people who are out and about. So I think the first and easy step is to publicize that mandate widely, and a variety of ways that the city already uses to publicize things. City website, Facebook, visitor center website and Facebook, the mayor's videos. And I think that this mask mandate has suffered to some extent from past publicity that there would be no enforcement of the mandates. I think we're still suffering from that. The reader boards we've talked about before, to include information about the necessity to wear masks on Laneda, because it is not possible to forecast when you'll be within 6 feet of someone when you're walking down a sidewalk. Information could be made available at all short-term rental houses and offices, information also at the visitor center. And then we would recommend that posters be put up at many places along Laneda and at entries to the town from the beach. So there's no expectation that people will be masked up on the beach. But when they come back into town, they should get information that, yeah, now's the time to put your mask on. And we do have an information sheet, if people would like to use that could be put in short-term rental houses about this recommendation and about how to wear your mask.
That's also on our website, just as a heads up.
So we have, Trish Johnson and I had a lot of fun because we like to do this kind of stuff, but we've got about 10 or 12 poster designs that we would like to make freely available to anybody to use. This is just one of them. Be a good dog, do your part, have your humans wear a mask. And just reminding people that masks are required on Laneda. I think people are pretty good about wearing them in businesses. At least that's what we see when they go into the Little Apple. People put their masks on. So I think information is the first step here. Here's another one that Trish designed, that only you can keep Manzanita open. We thought one approach would be to enlighten self-interest, that people, if they realize that if they like being in Manzanita and they like the stores being open, then they might want to consider wearing a mask. So as I explained, that we have an informational flyer that not only talks about that mandate, statewide mandate, but then says, well, what are the proper mask wearing practices? What kinds of masks should you wear and how should you take care of them? How should you wear them? So as Linda just said, that's up on the website, but hard copies could be made and put into businesses, short-term rentals, visitor center, all the places that we normally like to publicize things. I know there was a mask contest that the Hoffman Art Center had a while ago. So a city holiday mask contest is another idea, other fun happenings around masks. At one point we were talking about renaming the city Maskanita. So that's an idea of kind of a fun thing. We also would recommend that the city requires that city employees are masked up on Laneda and whenever they're interacting with residents and visitors, as a good example about best practices. And to make it easier, it would be nice if masks were available, sufficient masks were available at all short-term rentals. So then to see if your public information campaign works, of course, you want to monitor for compliance and then ramp up activities if necessary. And by that, I mean thinking about enforcement. So again, I think it goes beyond recommendation to requirement, and expectations of compliance would be the first step. The other part of the statewide requirements that I want to talk about tonight are this limiting social get-togethers to 10 people or fewer. This is a tougher one, and I think just the conversation that's already gone on in this meeting really hits on that point. One focus, obviously, is second homeowners and full-time residents. That's a harder group to reach than short-term rental folks. But the same ways that you might want to reach people for the mask information, you could think about providing information about the 10-person maximum. City website and Facebook, visitor center website and Facebook, mayor's videos, North Coast BBQ, et cetera. And maybe just discussions with your neighbors. That's something that I realized in the spring when the city was closing down and there was a recommendation that second homeowners really stay put where they were, is that I I had occasion to talk to a few of my neighbors. So if there's some way that people could be encouraged to, people who know about this mandate could be encouraged to talk to their neighbors, that would be helpful. And then the one that we've already talked about is the focus on short-term rentals for this limited size and social get-togethers. I think, Steve, you probably have, and Judy, you have better ideas than I do about how to reach that group. Posting occupancy information on the rental website, I think is better than doing it at the houses. It's really too late, obviously, when people are already here. Asking the rental companies to verify that there are no more than 10 in a party. It sounds like that kind of activity is already going on. And again, when you have that kind of educational campaign, you will expect compliance and you should monitor for compliance. And I realize that's difficult. The other two things I wanted to talk about, the next two steps. The first one is, how do you prepare for what I see will be coming, which is a county level change in phase of opening? So there is a lot of information on the OHA website about reopening and what criteria a county needs to make to open. It's clear to me they haven't really thought too much yet about exactly what will trigger a reclosing. We're in phase 2, as I mentioned. Phase 1 really wouldn't make that much difference for Manzanita, but obviously baseline would. That's the point at which businesses would be required to close. So, Steve, this is for you. You asked for information about how will we know, and we won't, I still want to emphasize, we really won't know when a surge comes to Manzanita. When a surge comes to Tillamook County, it's too late. But I wanted to share with you that there are 6 public health indicators that the state is, quote, considers in monitoring individual counties. And they do have this information on the OHA website. They don't really say what will trigger reclosing or changing a phase of a county, but these are the 6 things they consider. One is the % of ER visits for COVID-like illness. Well, they're only reporting this on the statewide basis, and it's currently 1.2%. So that's not really helpful for Tillamook County or for any county. It's just, is the state really getting overwhelmed by ER visits? That's the only question that would answer. The next 2, however, are things that we can look at in Tillamook County. One is the trend in the % of tests that are positive in the last 7 days. Of course, they never say compared to what, but I'm assuming it's compared to the previous 7 days, and it should not trend up. So the information available says, well, in the middle of October, we were doing okay, we were trending down. The last of October, we were trending up. We had almost 6% of the tests that were done were positive, and there were 130 some tests done. By the way, that's kind of the ballpark. There's about 100 to 125 or 30 tests done a week in Tillamook County, both private and public lab. That hasn't changed a lot in the last several months. So we are trending up. So that's an adverse indicator. We're such a small county that a lot of this stuff's not going to be very stable, we would say. So you might want to look at many weeks before you would decide that really is a true trend up. And you can see that with the next one, the % of increase in new cases in the last 7 days. And from the 18th to 24th of October, there were only 2 cases, and that was 80% down from the previous week. Well, the end of October, there were 7, so now it's 250% up. So again, because we have small numbers, they're kind of variable. They're more variable. But as the numbers get larger, which I predict that they will, I think we'll see that as an important, these 2 things will be important indicators, the trend in positive cases and the actual number of cases. And again, the increase in cases does not reflect an increase in tests being done. There really is no increase in testing being done in Tillamook County. The 4th indicator is the % of cases that are not traced to a known source. It should be less than 30%. So that's community transmission. Well, the 18th through 24th, that was both those cases. There were 2 cases. They were both from unknown sources. The county or the state hasn't posted the most recent information yet, so we don't know what that is. The 5th one is also not applicable to our county, the trend in COVID hospitalizations over the past 2 weeks. Since we only have 25 hospital beds in the county, that's really not going to be one that we'll ever be able to rely on. And as it's happening from Idaho, referrals out of Idaho to Oregon and Washington, I predict that what will happen in Tillamook County is that hospitalizations, people who need hospitalization will be sent to Portland. And the sixth one is the percent of cases in the last 7 days that were followed up by the county within 24 hours. And 100% of those 2 cases that occurred in that, I have trouble looking at the state data. Sometimes they have overlapping or differing week definitions. We will not know that. That's something that really would have to be reported to us. Both number 4 and 6 would have to be reported to us by the county health department. So long story short, really the only thing that we'll know is these 2. Are we getting more positive tests, and are we getting more cases in general? So what if these things do look like they're going in the wrong direction, which presently they do, what might the city of Manzanita want to do about that? And I would call those adverse indicators. Well, the first thing would be, again, to go back to the individual behavior change, the masks and the limiting of social gatherings. So I would say this city might want to step up efforts to influence or control residents and visitors' behavior, and that would get into the area of enforcement. Something that you could do now is formulate city policies regarding conditions of safe operation for offices, city offices, businesses, restaurants, bars, short-term rentals, hotels, and beach access. I think now's the time to figure out, what are you going to do? Remember what it was like in March when everybody was trying to figure out what to do, and it was panic time. Well, now's the time to figure that out. The county will, if the county goes back a phase or goes back to baseline, there will be regulations about offices, businesses, and restaurants and bars, but there are no regulations, as you know, about short-term rentals and hotels or beach access. So those are some of the things you might want to think about now and formulate policies for. And the final thing, I think Thomas is going to want to talk about this a little bit, is that if it's possible to do targeted testing, particularly as the rate of disease increases in the county and in our part of the county, these are some suggestions. And these were put together with Margaret Steele, who's the head of the Medical Reserve Corps for EVC. So targeted testing would be testing people that you think have a higher likelihood of having disease than just a random sample of people in the area. So one group would be, if there is local wastewater testing in a small enough area, you might want to do individual testing of people who are in an area that you know the virus is in the wastewater. Well, the thing about testing is it actually doesn't prevent disease unless you can do tracing and follow up all the cases found and their contacts. And some places in this country have given up on tracing just because they have so many cases. It's impossible to follow them up. So that's an important part. So testing doesn't prevent disease. How testing prevents disease is that you find out who those people's contacts are, you have them quarantine themselves, you have the cases isolate themselves, and so you limit the transmission that way. So you also need a plan to facilitate the isolation of all the positive patients, even if they don't have symptoms, and quarantining their contact. Tillamook County has some plans for this, the health department, and has some hotels designated for places that people can stay if they need to. So to work with Tillamook County Health Department would be important to make people safe so that they can isolate if they have disease and quarantine if they're contacts of people with disease. And then the final thing, again, is we're back to behavior change. We're back to, education. Local residents need to know how to isolate and quarantine, what the requirements are. What should you do if you have someone who's positive in your household? So that's all I've got. Kind of the end of the presentation, and kind of open it to questions.